we are shooting What Would Dayna Do today from St. Louis, Missouri, and you can see the beautiful fall foliage in the background, and the iconic arch is glowing in the sun. And you're probably all wondering, I am wearing my Seahawk colors today. Of course, most of you know I'm from Seattle. Seattle Seahawks and the St. Louis Rams are playing Monday night, and I get to go to the game. So we are shooting this month from St. Louis, Missouri. Our question today is from Katie. Katie works as a receptionist in Juneau, Alaska. And her question is, we want to start blocking out time for our new patients. Our new patient exam takes an hour and a half, and we have 2 hygienists. We want to know if you have any suggestion what has worked in other offices.
I do, and I'm a huge advocate of blocking out time in your schedule, making these mapping out your schedule for certain procedures. And new patients is a great way to do that, because if you don't have time in your schedule to see your new patients, they will pick up the phone and they'll call the office down the street that can get them in. So it's really important, no matter if your new patient goal is 10 new patients a month or 50 new patients a month, you have to make time for them in your schedule. So what I would suggest is blocking out, if you have 2 hygienists, I would do at least 2 or 4 new patient exams a day. Block them out in prime time locations, at least a couple times a week, because those new patients are going to expect you to have time for them, and they're going to expect you to be able to get them in when they want to be seen. So those early mornings, those late afternoon times are great where to put new patient time blocks. Now, when you're blocking out time for new patients in your hygiene schedule, it takes a lot of discipline on your scheduling coordinator to make sure that they keep those times open specifically for the new patient. So if one of your patients of record calls and they say, I'm looking for a time at 4 o'clock, and you have that new patient time block staring you in the face, you cannot give it away. You have to leave it there for the new patient. And my rule of thumb is 48 hours. Leave that new patient block there for 48 hours until it's time to fill it with something else. You have to leave that open time for those new patients. So I hope those suggestions are helpful for you, Katie, and good luck mapping out your schedule.